Hi there. This is another episode of SS Guni TV on YouTube. Today we are going to talk about diabetes, how to spot early signs and symptoms of diabetes and seek a medical care. So that is what we are going to talk about today. And we are in a very beautiful environment, so greenish and so refreshing. So whilst you are listening, you can enjoy the background, looking at how the atmosphere is. Before I continue, I want to tell my viewers that you people are watching the video without liking. Please like the video when you watch the video. Even if you don't like the video, you dislike it, and also tell us why you dislike it in the comment section below. It's very important. We need to know why you don't like the video, and if you like it, please like the video for us. Okay, the more you like it, the more people will get it to watch. So please, my viewers, when you watch the video, please like the video. It's very important. Like the video for us so that I can get about 60-70 views, but 2 likes, it's very bad. It's very bad. So please like the video for us. I'll be right back with more. I said we are going to talk about diabetes today, and when I return, we will know more about the early signs and symptoms of diabetes. I'll be right back. SS Guni TV. Eat well, exercise, and live a healthy lifestyle. Welcome back. We said in our introductory video that we are going to talk about the early signs and symptoms of diabetes. What is diabetes? Let's just brush through and let my viewers know what is diabetes. Diabetes is when the glucose is not being used by the body cells due to insufficient or lack of insulin. Insulin are hormones, they are chemicals which help our cells to get, or which drives glucose to our cells and allow our cells to be able to recognize glucose and pick them and use for energy. So if and the organ involved here is pancreas. That is the organ that produces insulin. So if your pancreas could not produce insulin at all, or it produces insulin, but the insulin is not sensitive enough for the body, for the body cells to use, then you have what we call either type 1 or type diabetes. So it could be either type 1 or type 2. Type 1 is you are insulin dependent. They have to inject you insulin before your cells could use the glucose, because your pancreas is not producing insulin at all. By the type 2 diabetes, your pancreas is producing insulin, but the insulin, the cells are not sensitive to the insulin. So the glucose is in the blood, it not being used until the chemical, the drugs are given, the anti-diabetic drugs are given, which will cause a kind of sensitivity, or it will make or drive help the how do they even call it? It will help the cells. Okay, it will help the cells to get the glucose. Okay, or help the cells and then the insulin, or will make the insulin do its work to allow the cells to pick up the glucose to use. So this is just a small information about diabetes. So we are going to talk about the early signs and symptoms of diabetes. 1, we have excessive thirst. 2, we have excessive hunger. Okay, poor wound healing is the 3rd one. The 4th one is frequent urination, and also tingling of the body. Okay, these are the early signs and symptoms of diabetes. When someone is developing diabetes, these are the early signs, and these are the things that you will experience. So when you are experiencing these signs, then you should know that you are developing diabetes, or you have developed diabetes. So go to the nearest health facility or the pharmacy and get your glucose level checked. When you get your glucose level checked and it is high, then you can come to the hospital for medical attention. So please take note of these early signs and symptoms of diabetes. We've mentioned excessive thirst, we've mentioned excessive hunger, we've mentioned poor wound healing, we've mentioned tingling of the hand, and also frequent urination. Okay, so let's take them one by one. Frequent urination. Per night, somebody can urinate more than 10 times. And when the person is going to urinate, the person will urinate a lot. Okay, the person will urinate a lot, more than 2 liters, 1 to 2 liters. Okay, so when it happens that way, and then it's frequent, the person comes back to sleep, and then 1 hour time the person is going to sleep, to urinate. 2 hours time the person is going to urinate, and it's disrupting the person's sleep, which is, so when you are experiencing this, wherever you find yourself, please know that you are having or you are developing diabetes. And another one we talk about is poor wound healing. Okay, poor wound healing. Diabetic people have poor wound healing because of the glucose level in their system. They have poor wound healing. So if you are having a wound and it is not healing, and it is always, the wound is growing, like expanding, then you have to seek for medical attention. The wound is expanding, the wound is, you are doing all that you could, it's not healing, and it is smelling. Okay, then you should know that you are developing diabetes. And another one we also talk about is excessive thirst. So the person will be drinking more water. Small time the person drinks water, small time the person drinks water because of the excessive thirst. And also frequent eating. Okay, the person eats 2 hours time, he eats again, another 2 hours time, he eats again. So that is excessive hunger. And also they gain weight or they lose weight. So if you are losing weight, if you are experiencing this kind of symptoms, including loss of weight, then you have to run to the hospital for medical attention. And also weight gain. Okay, people who are also developing diabetes can also gain weight, especially type 2 diabetes. They can also develop weight. So if this is happening to you, then you should know that you are developing diabetes. So please come to the hospital. Do not delay. Please do not delay. Don't wait until it is too late. We lost a guy, I think last month, because the person, he delayed in the house. So the sugar was so high. We gave insulin upon insulin upon insulin. We did all our interventions. We finally have to, refer the guy, but the guy couldn't make it. So please seek for early medical attention. It is very important. It is very important, viewers. Seek for early medical attention. It's very important. So this is my small information I have to give you. You have learned, I have also learned. Let's keep these tips in mind so that if it is happening to us or our relatives or our friends, we could help them get to the hospital on time. Please like our videos, share, and also subscribe. Okay, we need 100 subscribers this month, and we are appealing that you help us get the 100 subscribers. Please like our videos. Okay, when you watch the video, you like it so that other people can also get it to watch. So thank you for watching this video. Bye.